Welcome to today's video presentation. Today I will take a look at another STI. This time I am talking about one of the STIs that people who may be infected may not even be aware that they have this infection. It's very important, and we must learn to recognize the symptoms so that we can prevent it from happening or the consequences if they occur. So today I am taking a look at herpes simplex viral infection. There are two common types of herpes simplex viral infection. Herpes simplex viral infection 1 or herpes simplex virus 2. So, although these two viruses can affect and cause sexually transmitted infection, but herpes 2 causes STI more commonly than herpes simplex virus 1. Herpes simplex virus 1 affects mainly the skin and other parts of the body, whereas herpes simplex 2 affects the genitals, the anal region, and of course it can also affect the oral mucosa, the mouth, the tongue, and even the skin. So, how does somebody get infected with this herpes simplex virus? One of the commonest means of infection is by sexual contact. Any form of sexual contact can bring about herpes infection, herpes viral infection. And of course, the one that affects the genital area is otherwise called herpes genitalia, whereas the one that affects the oral mucosa, the mouth, is called herpes labial. Yes, herpes labialis. So, how does it get into the body? After a person is exposed, the virus may remain in the body for a period of time, 2 to 20 weeks, and then symptoms start manifesting. How does the herpes infection look like? It may present with fever. The person may have fever, may have body pains, may have flu-like symptoms, may have joint pains. That might be the initial symptoms presented. And after that, the person may have or show rashes. These kind of rashes are in groups. The rashes contain fluid or water, otherwise called vesicular rashes, and these rashes may coalesce into one and it will be on a base that is red. So when somebody has rashes on erythematous base, that might be herpes simplex viral infection. So after some times, the ulcers break down and become very painful. The pain of herpes viral infection is out of this world. It's so painful that the patient would be having a sting-like sensation, like a bee sting. If a bee stings somebody, that kind of feeling, so painful and intense, and there will be hot sensation in the body. This pain is one of the most painful things that a patient can experience. So, why is herpes simplex virus or herpes genitalia or herpes labialis important? It's important in the sense that some people who are carrying this viral infection may not even know that they have. And it is a highly contagious infection. Even by non-contact means, non-sexual means, people can have this infection. People can have this infection by kissing. If somebody has a sore on the lips, another person kisses that lip, the person can have the infection. If somebody has the sores on the skin and that skin comes in contact with another person, the person can have the infection. And of course, any of these infections have no cure. Herpes simplex viral infection has no cure. That is why it is important for us to know about this infection. Once the herpes virus enters the body, it will present with symptoms that we have mentioned, and the period for it to clear off may be as long as 6 months. Initial flame may not clear up, maybe as long as 6 months. Then after that, the rashes clears off, and once the rash have cleared off, the virus goes into hiding in what is called neural ganglia. It's a kind of swelling on the nerves. The viruses go there and hide. So the person feels alright that it's gone. No, it's not gone. At any point, the patient faces stress. There could be re-emergence of the rashes. The viruses can emerge from where they were hiding in the nerve ganglia. And of course, the subsequent symptoms and the duration of shedding may not be as intense as the initial infection. However, the patient will still be contagious if there are recurrence of the viruses. So herpes infection does not go away. The viruses only go into hiding in the neural ganglia and can resurface. Now, apart from these other symptoms that I have mentioned, other symptoms that a patient may have is painful urination. Patient may find it difficult to urinate, and there may be also lymph node, that's regional lymph node enlargement. Lymph nodes are organs that filter things in the body and can fight infection. So these viruses can get into those lymph nodes, lymphoid tissues, and make those lymph nodes to become enlarged. So regional lymph node enlargement may also be the presenting symptoms. And of course, ulcers and blisters in the genital areas, and the person may also have difficulty with defecation. The person may find it difficult to pass stools. They may develop constipation. Now, why this infection is important also is that there could be transmission from the mother to the child. That means there could be congenital herpes simplex viral infection. If a pregnant woman is newly infected, and then the child is given birth to, there is a high risk of the child that is born getting the infection during the passage through the birth canal. So pregnant women who have recent infection are at risk of transmitting the virus to their unborn children. So more so, anybody that has another infection such as HIV and AIDS has the higher risk of contracting herpes simplex viral infection. And of course, herpes simplex viral infection can also affect important organs of the body such as the eye. The eye can be affected to cause keratitis. The lining of the brain or the covering of the brain may also be attacked, cause meningitis. And people that have this kind of infection may present with headache and photophobia. Okay, so herpes viral infection, like we have mentioned, the one that is causing herpes labialis affects the oral mucosa, would present like a group of grape and is called common sores or cold sores. It's like a group of boils or appearing like grapes on the lips. So if anybody has a peck on that lip, that has these lesions, the person can contract herpes simplex virus 1. That is, the person may come down with herpes labialis. Alright, so what can somebody do to stay away, to prevent this infection that we know has no cure? The best thing to do is to stay far away from anything that might make somebody to have it, which is in most instances sexual intercourse. If somebody's partner has this lesion, the other partner who does not have the lesion must of necessity stay far away from the one that has the lesion until the lesions cleared off. Because like I've said, if somebody has skin lesion, by coming into contact with that skin, the other party can have it. So when a person is actively shedding the virus, another person should stay far away from the person in order not to contract it. And of course, for couples, for husbands and wives who wants to come together, they should use barrier method. It is advocated that they should use condom. But even condom itself does not cover all the parts that should cover. So any exposed area that comes in contact with the blisters, with the vesicles, with the ulcers, with the sores, can still be transmitting the infection. So abstinence is advocated. The use of condom is good, but not 100% safe. Okay? And so, what should somebody do? What should a patient do if they have this rash? Because this rash is very painful. I don't talk about medical treatment, but I am going to offer some tips of what should be done because of the stinking nature of the rash. So, before somebody can go and see the doctor for proper diagnosis and treatment, because of the fever, somebody should take something for fever. Yes, take something for fever. And of course, because of the stinging nature of the virus, somebody can use some home remedies like bathing in water that contains demulcent, as water that has some substances that has cooling effects. Okay, all right. Someone should also may benefit from the use of aloe vera gel, okay, or application of local anesthetic gel. That is just to ensure that the stinging nature of the rashes does not base much painful effects on the patient. So apart from these home remedies, somebody should go to the doctor where history would be made and laboratory investigations would be carried out, and then the doctor would prescribe medications for the patient. The medication that would be prescribed would help shorten the shedding period of the virus, but it will not cure, it will not eradicate the virus. Once the virus gets into the body, it remains for life. There could be a period of time when the viruses have gone into hiding. It could be a period of remission. So what should somebody do to prevent frequent recurrence? They should avoid stress, and they should eat good nutrition so that their immune system will not go down. Once the body's ability to fight infection goes down, maybe because of stress, maybe because the person is not eating well, the viruses may re-emerge. So I believe that today that we have learned something, that there is a particular sexually transmitted infection that causes severe pains because of the stinking nature, the hot sensation, the biting characteristic like a bee sting, and that this kind of infection is caused or transmitted by herpes simplex virus 1 and 2, that while 1 mainly attack the oral mucosa, the mouth and the skin, it can also attack the genital area, but 2 principally causes genital lesions, but it can also affect oral mucosa. That the one that causes herpes labialis is herpes simplex 1, and the one that causes herpes genitalis or genital herpes is herpes simplex virus 2. Urination can be painful and there could be hesitancy. That means somebody may have urge to go and urinate but may not be able to void easily, may not be able to pass urine easily because of the infection. Okay, and we also have seen that the lesion of herpes genitalia comes as by way of vesicles, that is rashes that contain fluid inside, and they sit on a erythematous base. That means on the skin will be red. Okay, then those lesions, those rashes will now sit on that red surface and they can come together. Many of them may come together and coalesce, that is joined together, then break down into ulcers or sores. Okay, and we've also seen that people like pregnant women can transmit this infection to their children, especially when this infection is acquired newly in pregnancy and when it is very close to the time of delivery. If it is detected early in pregnancy, the doctor can give the patient some treatment so that when the baby is born, the baby may not come down with what is called congenital herpes. So I want to believe that today we've been able to learn something about this STI, and that if we see them or we see the symptoms, we would know the right thing to do, both the home remedies that we can apply before we go and see our doctor, and when seeing our doctor we'll be able to get the proper treatment that will enable us live our normal life. Thank you very much for watching today's video. Please subscribe, follow, like, make comments and share this video so that others might see and also learn. The essence of this video is to disseminate information, to educate and to interact with members of the public. If you have any comments or any question, please do not hesitate to drop your comments in the comment box, and I will do the best that I can to make sure I respond as soon as possible. Thank you. Please like, subscribe and share. Stay safe from STI, stay safe from its complication, and remain blessed till I come your way next time. Good night.